So, hello class, and hello to all of you YouTubers and anyone who's on my Facebook. Also the Instagram people as well. Don't forget, you guys know I have Sapphire Physician Coding Facebook, Instagram, TikTok, Twitter. We have it all. So feel free to contact me whenever you need to. My email is llbcfink@sapphirecoding.com. I also use sapphire@gmail.com. Okay, and don't forget to subscribe. I'll mention that at the bottom. I know I haven't been on in a minute, but we're trying to get back into the swing of things. I want you guys to follow me, and you guys can take notes or what you need to. I am going to post this in the Sapphire class. I may have to dupe record it for YouTube. I don't know. It depends on, if they cut it off. Sometimes I go too long and it doesn't let me to post on YouTube. So today is Sunday. Okay. Today is Sunday. I think it's, what is it, May 5th? Let's go over some of the topics that I was asked about. Some of your emails that you guys are emailing me, I want to try to touch bases on some of those. I don't have it on, I don't have you guys sharing my screen right now, but I probably will have you share my screen when I show you what the encoder is. I don't have my best teacher attire on today, so bear with me. Not that I'm looking a mess. I just, I prefer to do it like this today. So I just want to talk about a couple of things that I may have discussed already or maybe not. So let's do this first. Make sure you guys have your current coding books for 2022. Your Hicks Picks, your ICD-10, and your CPT book. Make sure you have new books, especially when you are testing. I would prefer you have new books when you are studying, but it's okay if you have a year before book if you're studying, because some of the guidelines are the same and some of them have changed, but when you get ready to take your test, you're gonna have to get a new book. Okay? Because there are things that changed in the 2022. I'm just going through mines and I do see a lot of changes in there. So, make sure you go through the CPT page by page, put tabs where you want them. Remember, you cannot put any stickies in your book. Okay. And your classes in the Sapphire program, we always start off with ICD-10, and then we end the lesson with CPT. Okay, so let's get started. I have a couple of things in here that I'm going to go over just briefly. I don't know how long it's going to be, but let's just see. So the first thing I wanted to go over, someone asked me about the 82 and the 62. The 82 and the 62 provider involves two surgeons. If you have two surgeons that are doing a procedure, both surgeons will build the same code. You will add either 82 or 62. Okay. Go to your modifier section, read 82 and 62. I don't have it in front of me because it's going to take up time from me on the YouTube. I don't want it to cut off. So go look up 82 and 62. Now, remember the NPs and the PAs, they're just like physicians. So, most of them have their own NPI numbers. Some of them have tax ID numbers. They are still considered as physicians. Anything that is a non-provider billing, that's clinical staff, like the techs, the RNs, turnover techs, and nurses. That's non-clinical staff, so they don't have any NPIs or anything like that to bill. So those were a couple of questions that somebody asked me. I'm gonna pull out the 82 because I have my book in front of me. So I want you to get your book too. Just take a look at it. I'm gonna go to the modifier section And my book is already tabbed, so I can pretty much get right to the modifiers. So let me see what I have here. All right, so I'm gonna include 80 in that one too. So 62 is two surgeons. Okay, when two surgeons work together as primary surgeons, performing distinct parts. I'm not gonna read the whole thing. 80, assistant surgeon, surgical assistant service may be identified by adding modifier 80. 82, assistant surgeon, one qualified resident surgeon not available. The unavailability of a qualified resident surgeon is a prerequisite for use of modifier 82. Now, that may be on your test. Years ago, I remember having something like that on my test. Just make sure you can decipher between those three modifiers, okay? So we did the non-provider billing. So that was a question that was asked as far as the RNs, the techs, and people who are, people who are also involved in not the procedure or the surgery, but they're involved in getting the patient prepared. Okay, those people are not providers. They're considered as clinical staff. Okay. Provider addendum. So we're going to move on to provider addendum. When a PA or a nursing assistant sees a patient, let's say they're doing their rounds in a facility, they are looking at the patient, making sure the patient's okay, maybe after surgery or something like that. The provider may come in right behind the PA or the NP and just kind of check the patient out. The patient is being seen by both people. The provider can addend the notes and put in there, okay, I walked past, I saw the patient, I came in, I agree with nurse practitioner Tammy or XYZ. Okay, and they will put that in their note, and that is considered an addendum. Okay, both of those people will have a charge. Okay, just make sure you look for that. Okay. I wish I can give you an example of a note, but normally it will be at the top of the note and it will say addendum. That provider who did that addendum, he can bill for that, okay? Even if he was in there for 5 minutes, he still can bill for it because he went in there, okay? What else do we have? The nurse practitioner, she can also bill too because she's the one who saw the patient. Okay, military time. The procedures in a hospital normally always go by military time. Sometimes when you see it, just make sure you can decipher what it is. If you don't know what the time is when you see military time, just type it in on your computer and take heed to that, because I had an instant where one of the coders was coding a case and the provider put a different date where he actually did his addendum, but it was actually the same date that he was seeing the patient. The problem is he didn't do the addendum that day, he did it the next day. So we had to clarify that so she can get an understanding that the addendum was done the next day, but the provider was referring to the service that was done the day before. Okay, and the dead giveaway was the fact that the military time was like 4 or 5 minutes apart at the same time. Okay, so what else do we have there? So this is a note. I'm answering another email that I had got. Somebody asked me about if they're coding something and it doesn't make sense, or they can get close to what the code is, should they code it? No. You're either going to query the provider or you're just not going to do it. You're going to wait and get somebody to help you before you do it. So if it doesn't make sense, ask the provider. Don't be afraid to ask the provider. Just query the provider. I had some coders, they were, charge entry coders, and then they were kind of thrown into being a coder because there was no one to code. And they were like looking for other stuff that was already coded. That you're not supposed to do that. Most times the provider puts the code anyway, especially when you're doing charge entry coding. I mean, these days the providers actually put the ICD-10 and CPT on the note. And if they want those incentives, they have to do that. So some programs like which one was that? eClinical works when you're in that program where the doctors get the incentive. They're supposed to put the codes in. So if you're scared, you better be unscared because you're going to have to ask that provider, what is he talking about? What did he put? You have to code it precisely, okay? You can't just put anything in there. Okay, so what else? So get to know your provider. A lot of times when you have the same provider, let's say you have one specialty and you have like 3 or 4 same providers, you'll get to know how they do their notes and you'll be able to start deciphering them without even asking them. Now, this particular provider who did the notes the next day, I pretty much know what type of provider he is. He's just a quick provider. He do what he got to do, just keep it moving. So just take heed to that. Okay, so we talked about that as far as, and I'm talking about that as far as someone having one specialty or 2 specialties when you get to know your providers. Okay. Okay, so this was a question about how, what did she say? Okay, she wants to know how does she pick the right question. They have stuff on YouTube that show you how to take multiple choice tests. But if you have a question on your CPC, this is what this is all about. If you have a question on your CPT, okay, and the question relates to neuro, okay, the answer has to relate to neuro. If you have 3 answers talking about Apple Jacks and Quicks and stuff like that, and you have one that's talking about neuro, you know that's the answer. Okay. I'm gonna give you an example. TAP. Okay, so if you had a question that says, what is TAP? Okay, we're in neuro section, so just keep your mind in neuro. Don't go anywhere else. Okay, we're not talking about tap dancing or anything like that. So this is the multiple choice. A, Thomas, Andrea, and Paulina. B, throat, apple, pear. C, tearing a piece. D, transverse abdominis plane. You know the answer is D. Okay, so stay in that mode when you get ready to take your test. Okay, so I'm gonna finish with that one. Next question. Why do I need to use index cards? Okay, so her question is, why does she need to use index cards? Use index cards to help you retain. I know somebody who had like 10, 20 boxes of index cards. They took an exam, not this one, another exam, some kind of a construction exam, four or 5 times, finally passed on the 6th try. But listen, those index cards work. This person just happened to have PTSD and, he just, he had to take that test a few times to get it. Okay, so yes, you have to use index cards. I'm recommending that you use index cards. You can do this any other way that you want to. You don't have to use index cards. If you find another way to retain, then that's how I want you to retain. Okay. Let me see. Well, the cases in the CPC book. Yes, the new CPC guide. Even if you guys have the CPC guide from 2020, that's fine. The one from 2022, there's pretty much almost the same thing in there. The cases that are in the back of the chapters, yes, those are the cases that I want you to do. So her question is, in the classroom, where are the cases? So I put another note in, I just put it in there today. I want you to do the cases that are in the back of the CPC book. So if you are on neurology, and I'm saying neurology because you guys know I just finished endocrine and neurology. Go to that section, chapter 12, you're doing that procedure, those procedures and those cases in the back of that chapter. Okay. Ms. Lambert, what do you mean when you say providers going wild? I mean, you have some doctors that send notes on text. You have some doctors that send notes on emails. I mean, just totally outrageous. That's why I like to use that doctors gone wild. Emailing, you have them sending in notes and iPhones. I mean, that's not what you're supposed to do. So that's what I say when I say some doctors are going wild. Okay, so what else do we have? I'm gonna give you avulsion. What is the definition of avulsion? Tearing away, tearing away. It sounds like ablation, but ablation is more burning cold. Okay, transection to divide by transverse incision. Okay, so somebody asked that, even though that's in the classroom, go into neurology, that's in there. Okay. Can you go over facet joint? Facet joint injection may be described either as a nerve block or more intensive nerve destruction. Okay, so that's a quickie on the facet joint. I mentioned facet joint twice in the nervous system section. That's lesson 12. Lesson 12 is pretty long, but I think you guys can get through it. You guys can break it up. I have a couple of videos in there. I'm going to add some more things to it. Okay, so what else did I say I was going to go over? Oh, Encoder. So Encoder Pro Expert, that is a system where we code cases using electronic formats. So you guys know the test is hard. And remember, the test is transformed. It's only 4 hours now. But online, you can take it in 2 segments, but it's still one. If you take it in person, you fail one time, you get to go another time free. The test, you have to use your books. But when you guys actually go out there and start working, 9 times out of 10, you're going to use some type of encoder or some type of program that's going to help you code. In this case, I like the Encoder Pro because I'm pretty much used to it. That's the one that I have been using. You're going to type your code in there and it pops up everything that you need. If there are any changes with the code, it comes up. I'm going to switch over. I'm going to share my screen and I'm going to let you guys see that really quickly, just quickly 5 minutes. And then I'm going to go ahead and post this on the YouTube. So I'm going to share my screen real quick with you. Two seconds. Let's get it started. I'm going to start the video in there. I don't need to be on it, but I'm going to go ahead and share my screen with you. Okay, so I started the video. I don't know what's going on with my thing. I don't know if I have lipstick on or maybe I have leftover lipstick on. Anyway, so let's drop this down and I'm going to show you this. See, this is Encoder Pro. Okay, this is by Optum. All right, and this, this is just a quickie. If I put in 99203, see how quick that was? There's my code. Office or other outpatient visit for the evaluation and management of a new patient. Okay, you can read the rest if you want to, but it's in your book. But I just wanted to show you that. And all these tabs over here, this will all help you with your exam. You can't use it on your exam, but this is most likely what you'll do after you pass and start working as a coder. I'm not going to go over the whole thing, but I did just want to kind of show you some some tips in here. See where it says excludes prolonged services last 75 minutes or more. 99417. Besides coding really quickly, you can learn a lot from this. Okay, and that's why I wanted to touch bases on it. Let's put in a ICD-10 code. Look, let's go down. Let's navigate to ICD-10 and let's put in, I don't know what to put in. Is there an E61? Copper deficiency, iron deficiency. You see that? You see how fast it comes in? And look, this is what I was telling you about with the encoder. Includes 1, iron deficiency anemia. That means that you can use that with that code. You see what it says D50, D50.9? That's what it's telling you. So when we go further into the course, those of you who join the course, this class right here will be much longer. Okay, so this 19 minutes, I'm going to stop this in about 15 seconds. But this is what we're going to end with. And I just wanted to pretty much show you what this looks like. And you can always click here and you'll get a description. Okay. So I'm going to close this out. I'm going to stop this video and I will see you in the next video.